Hi, my name is Rohan,
And my name is Yan.
and together we are the creators of Sage, a social media platform for senior assistance, guidance, and engagement, our attempt at curing senior isolation. Senior isolation can be simply defined as feelings of chronic loneliness among the elderly. All around the globe, populations are becoming more and more skewed towards the elderly, but mortality and modern medicine's battle against it is only part of the story. Because at the end of the day, a lifespan is only a shallow statistic that doesn't convey anything about the quality of one's life, just the quantity of its duration. Thus arises the disparity between the lifespan and so called health span. In other words, how much of our longer lives are spent mentally and physically sound. It is this seldom acknowledged landscape in which senior isolation lies. Studies conducted by the NIA have proved isolation can cause fatal illnesses such as cancer, Alzheimer's, and obesity. Ultimately, though, senior isolation is about a core demographic being silenced, one whose guidance has been a fundamental part of the human narrative.
Enter Sage, our proposed solution to all of these problems by preventing situations which incite isolation. In developing Sage, we identify three recurrent themes in these scenarios: a lack of relatability, feelings of irrelevance, and the fear of being burdensome that restricts personal freedoms. We then developed three solutions to combat these scenarios: connect seniors to other seniors, provide a digital platform for seniors to share their perspectives, and supply them with tools to manage their health independently.
In the Sage app, these overarching principles are manifested through five central features: chats, bios, groups, forums, and health. Chats, bios, and groups work together to connect seniors to their peers. Specifically, bios are cookie-cutter templates of user information that allow seniors to search for those of similar backgrounds and interests, and provide handy conversation starters to jumpstart fledgling relationships. Chats, on the other hand, are private messaging clients to facilitate senior-to-senior communication, while groups allow multiple seniors to connect at once and schedule in-person meetups through a shared calendar and digital itinerary. Moving on, forums or public chat rooms are used to provide seniors with a public outlet to share their perspectives, organized around news and current events, real person queries about life-based challenges, and handcrafted prompts. To bring attention to these perspectives, we will also publish a publicly available monthly compilation of some of our users' most appreciated responses. Finally, Sage's health features also allow seniors to have more autonomy over their lives and foster less regulated relationships with their loved ones. These include a searchable database of geriatric diseases and their treatments, an interface for listing one's medicines and therapies that doubles as a health journal, and a dynamic directory of nearby elderly care professionals, such as geriatricians and gerontologists, to expedite the care-seeking process.
But you might be thinking, a social media platform? Do seniors even use technology? Can they? Yes. 67% of all seniors use the internet, and 50% have broadband at home. Considering society's to-be seniors will be even more heavily invested in technology, a technological solution will only become more effective, and acting before this trend is obvious will allow us to disrupt the current market. Furthermore, there are currently no other social media platforms designed to combat senior isolation. When it comes to dominant social media platforms such as Facebook and Twitter, niche platforms such as TikTok and Snapchat have proved that by targeting and designing for a specific population, these more specialized platforms can still be widely successful.
Sage's primary revenue stream will be produced through in-app interstitial ads managed via Google AdMob. As a secondary model, however, we will also leverage demographic data collected from users' bios and responses in forums. Information like this can be shared with news stations for polling purposes, data aggregators, and private companies to paint a more complete picture of seniors as consumers, and researchers, providing them with access to a difficult-to-find demographic. In particular, we will also pursue partnerships with the NIH, elderly tech companies, and mainstream news services such as Fox News and CNN.
Monetarily, we have two main sinks of capital: Google Firebase and Algolia, which will provide data storage, sharing, search, and authentication services and our marketing efforts. In terms of marketing, our main costs will come from internet advertisements. We will utilize Google and Instagram platforms, since both have a wide user base, targeting fundamentally different populations. Finally, we will also visit local senior communities to gauge impact and try to get featured on the App Store. This puts our year one cost at $2,000, requiring around 800 active users to offset. After we successfully gain 1,000 users, our year one goal, we will kickstart our auxiliary model of data selling.
As we gain profitability, we will expand Sage both in terms of platforms and features. While originally designed for iOS due to its simple and intuitive UI, we will also expand Sage to Android and web devices. Finally, we will focus on growing and refining our user interface and Sage's repertoire of features through tactics such as A and B testing and the hiring of professional designers. Ultimately, though, we will always temper our expansion with the necessity to accomplish Sage's eponymous mission: to assist, guide, and engage seniors, and remind them that even in this phase of their lives, despite the people they've been and person they are, the person they will and can be, a person who no longer struggles with isolation, is but a reach, tap, and conversation away.